Welcome everyone, welcome today. We are here with special guest, Congresswoman Stephanie Murphy. Thank you so much, Congresswoman Stephanie Murphy, for taking the time out today and visiting us here on Zoom. How are you doing?
I'm doing great, thank you. Thanks for having me.
Thank you. I really appreciate you coming out. I know everything is very busy right now. I am Bridget Lake, president of the Oviedo Winter Springs Regional Chamber of Commerce. We are here as a business resource for you. Right now, we are doing daily Zoom meetings. Today we have Congresswoman Stephanie Murphy with us, and we will be talking about a lot of things, especially with COVID going on right now and supporting our businesses. I know that this is a very important topic. Now, before we move on, I wanted to talk about our chamber resources that we have here for you. We have on OwiedoWinterSprings.org our COVID-19 resources tab. That tab has everything that you would need, from links to helping businesses when it comes to loans. We also have all of our recorded webinars on there. So if you wanted to check out something that you missed, we also have our Facebook, our discussion group, our Facebook page. So check out Oviedo Winter Springs Regional Chamber of Commerce Facebook page. And we have some of our upcoming events. A big one that we have coming up is our COVID-19 hospital update coming up, sponsored by Compassionate Cremations. It is this Thursday, April 16th. We will have Oviedo Medical Center, Advent Health, and Orlando Health there. So be ready for that one. And on Friday, April 17th at 1 p.m., we have the Florida Executive Order discussion with Chief Administrator Alan Harris from Seminole County Emergency Management, sponsored by Compassionate Cremations. Thank you to our sponsors. I hope that you'll join us for all of our Zoom meetings that we have coming up. Some really important topics, great information. And if you missed any of them, go to OwiedoWinterSprings.org and check them out on our COVID-19 resources tab. I want to thank today's sponsor, A Budget Tree Service. A Budget Tree Service is one of our local essential businesses here, a huge supporter in our community, and they pride themselves in making our neighborhoods safer, one tree at a time. Thank you so much to A Budget Tree Service for sponsoring today. And now I would like to introduce Congresswoman Stephanie Murphy. Congresswoman Murphy proudly represents Florida's 7th Congressional District in the U.S. House of Representatives. The district includes all of Seminole County and much of northern Orange County, including downtown Orlando, Maitland, Winter Park, and the University of Central Florida. She currently serves on the influential House and Ways and Means Committee, where she is a member of the Subcommittee on Trade and Subcommittee on Worker and Family Support. Congresswoman Murphy holds an MS in Foreign Service from Georgetown University and a BA in Economics from the College of William and Mary. She lives in Winter Park, Florida, and with her husband and 2 children. Congresswoman Murphy, thank you so much for joining us. Would you like to give us a brief update on what you've been working on?
Sure. Thanks so much, Bridget, for organizing this call and letting me join you all to talk about our congressional response to COVID-19. I know that this has been an incredibly difficult time for all of us. What I think I'd love to do is, as you mentioned, provide some brief framing remarks and outline what Congress has done and is continuing to do to combat COVID. And then I think I'll focus on the parts of our response that I think would be most useful to you and your members. But I want the information to flow both ways. I've done a number of these calls now, and hearing from your members is incredibly important to me and to informing the work that we do moving forward. So, as you all know, COVID-19 is first and foremost a public health crisis, but it's also created a very sudden and very profound economic crisis. And a broad range of businesses are being forced to shutter or dramatically scale back their operations. And so these businesses that a few months ago were doing well and thriving, now they stand at the brink of uncertainty. Same with families. Families that had stable jobs just a few months ago are now confronting the prospect of unemployment. retirement and investment accounts are losing value. Our kids are at home, missing out on their education because their daycare or school or college has been closed. And we're all trying to, I think, both homeschool and telework at the same time, and the challenges of that. And we've been making a lot of personal decisions, I think, in order to help with this public health crisis. And I understand that we're doing so in a country that's really committed to this principle of personal freedom. It's one of our founding principles. It's one of the reasons I love this country so much. But right now, we're all making some personal sacrifices for the common good. And all that being said, you know, with COVID-19 being a threat to public health, I think the only way we see ourselves out of this crisis is by using science and medicine. So we have to conduct far more testing and to identify people with COVID so that we can treat them and isolate them. We need better therapeutics for people with COVID so that they survive contracting the virus and are able to recover, and so that we can keep the mortality rate low. We need a large-scale Manhattan Project-style research effort to develop a vaccine. And that's really the only way this crisis ends. And until then, we just have to keep working together to provide support to workers and businesses who are being hurt by a force beyond their control, and to provide support to our healthcare providers and our frontline folks on this pandemic. As you all probably know, Congress has passed 3 bipartisan bills in the span of a month. It's pretty significant legislation that's been passed. I just want to talk about some of the key provisions. We started by funding research and development of testing, treatments, and vaccines, and the production of vital medical equipment and supplies. And I think it's been accurately described as a Marshall Plan for health workers, hospitals, and our healthcare system. We provided free COVID-19 testing for all Americans, whether they have insurance or not. And in Florida, we're still working through the kinks of getting that implemented. We've provided 2 weeks of paid sick leave for workers who are sick or who are quarantined, or who are caring for a family member who's sick or quarantined. And then we provided an additional 10 weeks of paid family and medical leave for workers who have to stay home and take care of a child whose school has closed. I was really involved in drafting this provision, and it's not perfect after it came out of the sausage making machine, but I'm proud that we made a step in the right direction. Employers will provide these benefits to their workers, and they'll get reimbursed by the federal government at 100%. We are also providing nearly every adult who has a Social Security number with a check for $1,200 and an additional $500 per child. And these amounts begin to phase out for individuals earning more than $75,000 or $150,000 for married couples. And I know the IRS is trying to get these checks out the door as soon as possible. I believe that the folks with direct deposit will be the first to receive these payments. The payments began today, so some folks should be seeing money in their accounts. We've also made a massive investment in state unemployment insurance programs, so workers who lose their jobs still get the support they need to take care of themselves and their family. And I think this is particularly important in Florida, which has probably the least generous unemployment insurance program in the country. And specifically on unemployment, we provided every American receiving unemployment with a $600 increase in their weekly benefits for 4 months, which is an increase in the length of time the benefits can be received. And it also expanded it to allow part-time, self-employed, and gig economy workers to access these benefits, which is something they had not been able to do in the past. We've made a range of assistance available to struggling small businesses and their employees, including nonprofit organizations, self-employed workers, and startups. And as most of you know by now, the Paycheck Protection Program, or I'm going to call it the SBA P3, even though P3 means in other contexts, public-private partnerships. But in this case, the Paycheck Protection Program, P3, provided $350 billion in forgivable loans to small businesses who keep their existing workforce and help pay for other expenses like rent, mortgage, and utilities. The CARES Act also expanded the EIDL loan program to include an emergency grant of up to $10,000 so that we can get immediate relief to firms to help cover their operating costs. And then we provided $17 billion to cover 6 months of payments for small businesses who already have an existing SBA loan. I know there are a lot of concerns and issues with the launch of the SBA P3 program, and I hear them from constituents and chambers and businesses all the time. And I'm really happy to continue to get your feedback since the guidance and experiences you're having are kind of changing, and we want to be able to make this program work. I'm also aware of the concern about 501c6 organizations like your chamber not being able to process or access that P3. We're really trying to make this work, and many other changes to the P3 to help get as much money as possible into the hands of small businesses and organizations. But we need to do this alongside any additional funding. Otherwise, we're just going to be putting good money after bad. And this is part of the debate that's happening in the Senate right now, and will be a critical part of CARES, this emergency package, or whatever we want to call this. And then finally, I just want to highlight a provision that I'm particularly proud of. It's a proposal I've been pushing called the Employee Retention Tax Credit, or the ERTC. We fought really hard to get this in the final bill. It wasn't originally in the Senate bill, but we were able to get it in there with some bipartisan and bicameral collaboration. The ERTC is essentially a fully refundable tax credit that employers of any size can use. The credit is equal to 50% of qualified wages paid to an employee up to a total of $10,000 in qualified wages per employee. And the credit would be taken against employment taxes, with any excess refunded directly to the employer. It's available to employers that had to fully or partially suspend their operations due to some of these government orders to shelter in place, or any company that had a 50% decline in gross receipts for any quarter year over year compared to 2019. Employers with 100 or fewer employees, the credit goes to wages paid to all workers, whether they're actively working or furloughed. And for employers over 100 employees, the credit goes to wages paid to furloughed workers only. And really the goal of the ERTC is to help employers who help their employees, keeping them on payroll rather than laying them off. I think it's really important to keep workers tethered to their jobs at this point. I'm excited about this credit. I'm hopeful it'll be useful to both employers and employees, but I think there's more work to be done there. It can be expanded to cover more wages, and that's something I'm focused on moving forward. Look, there's a lot of work yet to be done. My office is continuing to push for additional relief to American families and American businesses. And if you own a business, my office is ready to help walk you through the various options that are now available to you under law, as well as receiving any feedback on the pain points that you're feeling as you're applying for assistance. And if we can be helpful there or take your feedback and improve these programs, we want to be able to do that. So with that, I just want to thank you again for being on this call. I'm happy to answer your questions and to hear your comments.
And thank you so much. I do want to let you know that just on Friday, and the chambers have all been working together, the U.S. Chamber, Florida Chamber, chambers all across the United States. We put out a letter, the U.S. Chamber pushed out a letter to D.C. asking that we urge Congress to quickly bolster its commitment to the survival of small businesses across America by renewing funding for the EIDL program and increasing funding for the PPP, the Paycheck Protection Program. The U.S. Chamber of Commerce applauds Congress for their swift bipartisan action on 3 laws in 3 weeks to provide Americans with aid during coronavirus pandemic. These pandemic response bills show Congress at its best. So yes, we do want to thank you. We also want to encourage that continue to fund these programs, because small businesses, not only are they not receiving the money yet, it sounds like they're not able to get as much money as they need to survive. So I do want to make that comment before I actually get into my first question. So I did forward that letter to your office.
Great, thanks.
And I did also want to mention, I'd be remiss if I didn't bring up how 501c6s, chambers of commerce, are not actually eligible to partake in any of these stimulus packages. Us being a small business ourselves, some of us have already shut down. Most only have enough of 2 months of reserves. As chambers are essential businesses and being on the front line of supporting our business community, would you support 501c6s or chambers being in the next stimulus package, as long as it has the stipulation that it would not go to organizations that do federal lobbying? We are in dire need, just as small businesses are.
Yeah, as I mentioned in my opening remarks, I'm aware that organizations 501c6s cannot apply for the P3 program, and we're working on it. Yes, I would support that. I recognize that you, in normal times, get your resources from the small businesses and the businesses that are your members, and in these unusual times, that's not really a possibility. And so we need to be able to keep the important role of helping businesses through chambers available as all businesses try to navigate the different policies that are changing, the laws, the programs that are available. So I'll keep working on that, but we are aware of the issue and appreciate the role that you serve in your community.
Thank you so much. I do appreciate that, and many chambers are watching right now, so I want to thank you for your support of us. The unemployment system has become a target for criticism, yet no one really expected the overload of unemployment claims. And we understand that it continues to, they continue to try to solve this issue. There is a paper form, instead of doing the online form that you can actually fill out, and FedEx will actually overnight it to them for free, from what I understand. Is that correct?
Yes, there is a paper form, but let me just take a step back and talk a little bit about Florida's unemployment. While you are right that nobody could have predicted the, a significant increase in the number of applicants for unemployment, what is true, though, is that Florida has probably one of the worst systems in our country. And for better or for worse, the unemployment system is a combined federal and state partnership, and it has a lot of variability between the states. And each state takes money from the federal government to run the unemployment system. And unfortunately, in Florida, it's not an accident that our system is so bad. It was orchestrated intentionally by previous and current administrations, to be a difficult process. And unfortunately, now when it's not a matter, you can't dispute whether it's a willingness to work, which is usually what's behind the development of programs that don't function well for people seeking unemployment, where now it's not a matter of willingness. People simply cannot work. And that means that the state needs to step up, take the responsibility, and do better for Floridians. We've provided significant funding to expand unemployment during this crisis. In addition to $1.6 billion over the last 10 years that Florida has received to administer the UI program, it just got another $60 million to expand the program. So I think it's an earned benefit. And I think it's a shame that people who are now in most need of this benefit are having such a hard time accessing it. But gratefully, I guess, we're in the 21st century going back to a paper form to allow people to fill it out. But that doesn't matter if we don't have people processing those claims. And, I think we have to hold this administration, this Florida State Administration accountable to implementing this program better. And I've called for a Department of Labor Inspector General to audit Florida's program. I serve on the Ways and Means Committee, and the implementation of unemployment is within our jurisdiction. And my hope is that we'll identify ways in which to make this system better and to help Florida do better on behalf of its constituents.
On a quick follow-up for that, will there be any back pay for those who just were not able to get into the system quick enough? Because a lot of those, let's say were not able to get in 3 weeks ago, they still have those bills to pay and just were not able to get in there in a timely manner.
The way that it's structured now, it starts from the day of employer separation. So the answer would be yes, it should be based on the date of unemployment.
Thank you so much. And I'm going to start going to some of the questions that we have in the chat box. If you do have questions for Congresswoman Murphy, let's make sure that you type those in the chat box, and I will get to them one at a time. And it just shows you how dire the situation is when I say this next question. How can I get the rapid COVID-19 test deployed to my wife's memory care community, ALF is in parentheses, in Winter Springs? She is registered with the Brain Bank and confirmed with early onset Alzheimer's. Should she or other residents registered with the Brain Bank die while this pandemic ravages our communities, her body would need to be confirmed as not having COVID-19 in order to have her brain autopsied within 12 hours of passing. Without the individual ALFs having rapid test kits on site, my wife, as well as any other residents registered with the Brain Bank, families and research would be major losers. Please help.
Yeah, so we can definitely get the specifics on this gentleman's case and see what we can do, because I am aware that we have National Guard who is going to some of the senior homes and conducting some of this test. There is a new 45-minute and 5-minute test that's being used in some of our major hospitals and are also being used to spot check nursing homes. So we can take a look at the specific here, but I think what the big takeaway for this is that we need to have more tests all around, and Congress has funded billions of dollars in expanding the testing, but we're running into some of the same issues in implementing the federal dollars around supply chains and such. You know, it's really important that we take those federal resources and get them out to places like the one that this gentleman raised. And if you will call my office, we'll get a caseworker to connect with you and see if we can't connect you with one of the state resources to add this facility into the spot checking that they are doing. And you know, Governor DeSantis has been out there touting the state's high testing count. He thinks that the state will soon have the results of 1 in 100 Floridians. I certainly hope that that is true, and we'll be holding him accountable and requiring some transparency to the results that come out of that. And again, for this specific person, if you want to give our office a call and we'll work with you specifically on your particular case, it's 888-205-5421.
Thank you. And that does sound, I did have another question that was texted and it said, do you think the state or federal government will be able to ramp up much more testing for the coronavirus and the antibody? And it sounds like that's what they're trying to do.
Yeah, they're trying to do that, but also our local hospitals are doing really good work on ramping up testing. I was just on with Advent, who has a drive-through testing facility downtown, and they are increasing the number of their facilities that will do drive-through testing. They think they have 8 drive-up testing at existing facilities that they have right now, and they think that they're going to be able to get up to 1,000 tests per day through that downtown testing location. So, and they've put in the request for that Avid testing system, which is the one that can do quick turn testing, you know, I think it's both the hospital and healthcare providers, as well as the state and federal, that have to all work together to try to get testing ramped up as fast as possible.
Thank you so much. I'm going to go on to the next question. I'm a real estate agent, and we've had a lot of questions from real estate agents, 1099 employees, people who are single, and you know, they're one-person shops, and they have not been able to get the help that they've needed. So here's the question. I'm a real estate agent, not typically eligible for unemployment compensation. However, my business has effectively stopped. Is the $600 supplemental unemployment compensation available to realtors? If so, how do I register?
Right. So unemployment benefits, we expanded unemployment benefits so that they would include self-employed and independent contractors, including realtors, people who are fully or partially unemployed as a direct result of COVID-19, beginning on January 27, 2020 through December 31, 2020. So we made the expansion, and as long as and the $600 federal supplement to the state unemployment is for anybody who is on unemployment. So as long as they are able to get through the state system, they are legally entitled to that payment. So to apply for unemployment compensation benefits, you have to start at the state of Florida's unemployment website, which has had some problems over the last few weeks, but they have also set up a new mobile-friendly website, or you could apply using the paper form, as we mentioned in the previous question. So there are a couple of routes in, and hopefully the governor continues to put focus on improving that system so that your application can get processed. But as a realtor or self-employed independent contractor, you are legally entitled to that payment as long as you can get through the unemployment system.
And that would be, because it looks like our next question is, would someone who's a 1099 employee file for unemployment or through the small business loan at a bank? And it sounds like the 1099 employee needs to file through.
You can do both. So depending on how you want to handle your situation, whether it works better for you to file for unemployment, or would you rather have a P3 loan? And unfortunately, right now, the way that the P3 loan works is you'll want to kind of assess whether or not you meet the criteria to be able to get a bank to process your application for the P3. My understanding is that banks are prioritizing their customers with an existing relationship, and then prioritizing within that individuals who have an existing loan, which is unfortunate because small businesses, I know, really pride themselves in bootstrapping sometimes. And so if they don't have a loan, they feel like they have run their business, played by the rules, and now they're at the back of the line for this P3 grant, which I think is unfair, and we have to get that fixed. But you know, if I'm the individual, I would assess whether it makes more sense for me as an independent contractor to go through the P3 loan route, and also whether or not I have the relationships such that I would get considered for a P3 loan, relationships with a bank in order to do that, or whether it would be more financially advantageous for me to do the unemployment. But both options are available for folks.
Thank you so much. Thank you for clarifying that. I heard, and this is another question, I heard that several state representatives have provided some of their staff members to assist DEO, the Department of Economic Opportunity, with the unemployment processing backlog. Has your office looked into participating in this? And if not, is this something your local office is willing to assist with?
We have 5 employees in Florida, and we are literally spending every waking hour processing constituent problems it's what we call casework, whether that is people who need access to their medical or health benefits, or their unemployment benefits, or small businesses trying to access their loans. We are operating at full capacity as it is, fielding complaints with the system and repatriating Americans from overseas. There are a number of things that only a federal congressional office can engage in, and we are operating at full capacity doing all of those things, whether that's getting people access to their unemployment benefits, their health benefits, or they're bringing them back from overseas, or working with small businesses, you name it. My employees are full up at capacity, fielding constituent complaints. And look, Congress has authorized millions for Florida to hire and build up its unemployment systems. I would encourage the governor to hire people who've recently lost their jobs to help with the unemployment program. There are a lot of ways for them to fill that, the HR shortage on processing the backlog. So, and anyways, our office is full up with the responsibilities we have as a congressional district office.
Thank you. And I did get a comment that said, thank you and your staff for all that you guys do. And a question, or actually a comment on the PPP applications, as far as P3 loans, they are voluntary by the lender to participate in the program at all. Applicants can file with any SBA authorized entity and not just banks. Many third-party lenders are processing those on a first-come, first-served basis with no preference for existing borrowers. So there's a little piece of information if you are looking for a 3P loan, that third-party lenders are processing those on a first-come, first-served basis. Let me ask, and I've been asking.
I would just point out that part of this is last Wednesday, the SBA finally opened up their portal for because originally it was just folks that had processed 7A loans. And then they opened up their portal last Wednesday to allow a broader set of non-bank lenders to participate in the P3 program. And they are trying to bring those people on board as fast as they can to provide people other points of entry into the P3 loan program.
Thank you, thank you. And I've been asking a lot of people this when they come onto our Zoom meetings. When was that moment that you realized everything was about to change? And where were you? Like, what news did you get, or what had happened at that moment that you just went, wow, this is all going to change?
It was in January, and it's reflected in the work that my office has done. We saw the news reports out of China, and when I worked at the Department of Defense, I worked on avian flu. And I'll tell you that the pandemic planning that I did and the war games that we did around pandemics left a lasting impression on me. And as soon as I saw similar reporting as we did when the avian flu was an issue back in 2005, I knew that we needed to try to get ahead of it, because when we did those, luckily avian flu, it was a near miss for us. It didn't end up manifesting itself. But in all of the exercises that we ran around that pandemic to determine what we needed to do to prepare for it, I always remember feeling, and it was just in an exercise situation, feeling as if we were behind the curve. We could never get ourselves in front of the spread of that disease. And that experience, just the exercise part, left a lasting impression on me. So when I saw the reporting coming out of China in January, I knew that we needed to start moving. And so that's why I sent a letter to HHS and Homeland Security on February 3rd, telling them that Florida faced a unique problem because we had this combination of tourists, like 72 million tourists, and more mature Americans who at that time looked uniquely vulnerable to the virus, and that combination made our state uniquely vulnerable. And, you know, but I was hearing very little out of our state government. And so I held a roundtable on February 17th, bringing in Seminole County and Orange County emergency response departments, and had an infectious disease expert, had a representative from Nemours Hospital there to provide people with information about how to keep yourself safe in a pandemic. That roundtable was held on February 17th, and our first case in Florida wasn't until March. So, you know, I'm sorry to see that I'm living the exercise that I went through 15 years ago in real life now. But for me, I took this problem seriously way before I think we began to see the impact on our community. And I think it's important that after we get through this crisis, that we have a look back to figure out how we can be better prepared going forward. And that's why I've proposed a 9/11 style commission that wouldn't go into effect until next year, into 2021, that's bipartisan, to take an objective look at how we could make our country safer against this pandemic threat.
Thank you so much. And I know you have a limited amount of time, so I'm going to ask the last question, and it actually kind of wraps into that previous one. Is Congresswoman Murphy, knowing how devastating COVID-19 is and has had on our economy and our business community, if you would have done anything differently in the past few months and you had the sole power to do that, what would you have done differently?
I think I would have had a clear chain of command, not 5 different or 10 different people to plug into the federal government's response. I would have allowed science and public health officials and medical officials to lead. I would have had more clear, consistent communication. And then the thing that is so critically important is testing. That there are already quite a bit of information about how this country kind of we lost valuable time building out testing. And now we're trying to catch up to that. But testing is going to be key to how we get out of this issue. And we're still trying to expand that capacity. I think, you know, and then, you know, I think it would take too long to list all the possible policy changes that I would have done with regards to the economics. While I agree with the first couple of bills that really focused on healthcare and putting money into finding a health-driven path out of this public health crisis, I think we should have gone bigger on the CARES Act. We didn't provide as much backstop to people's payroll as we should have. If you look to other countries, whether it's Canada or Europe, they recognize that forcing people to stay home was going to cause a lot of people to lose their jobs. And our #1 priority should have been to keep workers tethered to their jobs and their benefits. Because if you can do that, then you prevent having people go to unemployment and all the issues that we've had with that. And you wouldn't need to ask small businesses to go out and take a loan at a time when they've lost all their revenue. The last thing you want to do is to pile on debt. And I just think the most direct way to help workers is to use the path of least resistance to get federal dollars through to employees by working through their employer. That's why I was such a big proponent of the employee retention tax credit. I think it needs to be more substantial than what we were able to get passed through. And we shouldn't I think the last thing I would say is that I wish that all of my colleagues, as we look at how we work on this issue, we realize that we are in a public health crisis, not a recession, not a financial crisis, not It's not any of the normal things. And so we have to set aside our ideologies around, government assistance, around Medicaid, around family medical and paid leave, because all of those things don't apply in this situation. In this situation, we should allow some flexibility for the duration of this crisis to provide as much help directly to the American people as we can. And we have to also understand that, like, if I'm a worker, I don't distinguish between whether I have a job with what the SBA considers a small business or medium-sized business or a large business. I just know I have a job. And so we should be protecting American jobs all across the board. So there's a lot that we could do, and there'll be time for that. But right now, focused on trying to do what we can as fast as we can.
Thank you so much for joining us. Thank you. You will continue to hear from us at the Chamber. If people do want to reach out to you, is there any information you'd like to give us right now?
Well, you can reach my office through our website or our phone number if you run into any issues navigating any of the federal agencies, and even if it's a state related thing, our office will get shoulder to shoulder with you and help you. Murphy.house.gov is my website, murphy.house.gov. And my phone number is 888-205-5421. If you go to our website, you'll find a whole page on coronavirus that includes resources and other things that will be useful to you in this time period. And then, the last thing I will say is, we can shorten this economic crisis by shortening the public health crisis. And that means that we all have to do our part and to stay home, to prevent the spread. We can get through this together. And my office stands by to help you with any of the specifics that you have in trying to both making sure that you have the resources you need to survive this crisis. So.
Thank you so much, Congresswoman Murphy. Thank you for taking the time. I know how busy you are. You have a wonderful day. Everyone, this recording will be on our website, oviedo-wintersprings.org. It will probably be up there by tomorrow. It is sponsored by A Budget Tree Service, an essential service in our area. Thank you so much, everyone. Have a wonderful afternoon.